joint test is the same as it would be for the anterior joint. You're just applying a posterior force instead of the anterior force. So you have both hands like just above the tibial tuberosity, and you're just going to apply that posterior force. And if there's any indication of a PCL tear, you're going to see, you're really going to see the tibia just move posteriorly. Now another test for the PCL is the sag test. So you just have the athlete have their leg at 90 degrees. An indication of a posterior collateral ligament tear, you'll see indentation right here as the tibia is going to move posteriorly. So you'll see that sag. Okay, so moving on to meniscus special tests. So the first test you can do is a bounce test, and this is just going to show any sort of apprehension that they may have, like any pain. So you're just going to straighten out, have them relax and straighten out the leg. And you'll see a bounce once they straighten the leg, and that can cause them some pain as well. Another test that you can do is McMurray's, and you're just going to move the leg into 90 degrees and bring it back straight while applying varus and valgus forces as you move. And you should feel like a clunk while you're doing this. And they should feel some pain if there's any indication of a meniscal tear. So they'll also express some joint line tenderness as you're palpating, as I said before. Another test that they can do is just a duck walk. So have your athlete stand up. Duck walk. So you're going to have them crouch to about 90 degrees and then just walk forward a few steps. They should experience some pain in their meniscus if that's going to show a positive tear. Okay? Okay, yeah. Okay, so you can also, there are some special tests for patellar dislocations, patellar tendon strains. One of them is a patellar apprehension test. So for this, you can just move the patellar laterally. A positive sign to this is the athlete will show apprehension with the movement of the patellar laterally. You know, they could be afraid of you moving. It could dislocate the patellar once again. Another one is the patellar grind test. So this, you just press down onto the patella, pushing force in, and then just moving the patella laterally again. This should recreate some pain that they had, and so also what you can do is look for a change in their Q angle. Female Q angle is about 10 degrees. That's the angle from their ASIS up here down to their tibial tuberosity. Sorry, down to the middle of their kneecap to their tibial tuberosity. So if there's a change outside of 10% on that, or 10 degrees, that could be an indication of some sort of patellar trauma as well.